Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, friends, we are back. It is still Healthy Living Tuesday right here on KM News Extra. And once again, please help me in welcoming Dr. Jitka Lom from Express Care. She's here, and as she does every Tuesday, she takes your questions regarding a litany of medical concerns. Tonight, we are talking about cuts, bites, scratches, and wounds. Kind of, doctor, a kind of gross thing, but important nonetheless.
Yes, it is.
Okay, and maybe, you know, more common in kids, I would assume, and everything, but, you know, going all the way up to adults and elderly and everything like that, still important to take care of.
Still.
Okay, so we have some questions from our online community. We asked them to send us their comments and questions on our Facebook page, so we'll get to those. But first, what is the first thing one should know about treating a cut or abrasion, or maybe the severity of it? What is the difference between, you know, like a garden variety, a nick or a cut, and, you know, like a gash or an abrasion?
Right. So if you get a cut or an abrasion, the first thing you should do is wash it with clean water and soap, and continue to wash it for about as long as it would take to sing the happy birthday song. Then you'll know that it'll be quite clean. One of the big mistakes that people do is run for the bottle of hydrogen peroxide, you know, that brown bottle, and start dumping the peroxide on their wound. And that causes a lot of foaming and stinging and pain and really severe irritation of the wound, and it's not necessary. Just plain soap and water, clean water, rinsing off the wound, singing the song, making sure that the wound is clean, then patting dry and putting on a dressing.
What type of soap?
Any kind of soap.
Like even like liquid soap or bar soap?
Any soap, okay. Any soap. That's to get the bacteria or any debris out of the wound.
Okay.
Now, of course, if this is a wound that's gushing blood and you know, it's a very large or very deep wound, then you won't be wanting to clean it. You'll just put pressure on it to stop bleeding. And there, the mistake people make is that they put pressure only for a very short time, and they keep checking to see if the wound has stopped bleeding, so they don't give it enough time to clot. So if it's a very large wound or gash, put pressure. Look at your watch. Don't even bother looking at the wound for about 10 minutes. And then take a look and see if the bleeding has stopped. Guilty
as charged. 8th grade, I fell off my skateboard and everything. I kept looking and it kept bleeding. So,
yes.
You know, and the doctor told me, he goes, "You're not a very bright young boy, are you?"
Oh,
so,
not
that's,
true.
Well, that's another story. But you know, what are some of the telltale signs, Dr. Lom, to know if your wound gets to the point where you require stitches? Because, you know, you talked about profuse bleeding and everything like that. But how do you know if your wound is at the next level and requires medical care?
And that's a good question. Wounds, if they're going to be sutured, stitched together, there's a window of time of only 6 hours. So if you're on the 4th hour of your cut and it's still bleeding, you need to get attention, knowing that it's going to take an hour or so to get through to any clinic or emergency department. Once you've passed the 6-hour window, then usually we don't suture wounds anymore. It's too late. There's a much higher risk of infection. So if your wound, I would just say if your wound is bleeding still after 1 hour, you need to go get it checked.
Yep. How about injuries that you may sustain, like say, while you're playing sports, or if you're working out, you know, like a construction worker working at a job site and he just happens, you know, hit himself with a hammer pretty, you know, and shatters his nail or something like that. How can you treat, you know, yourself before you have, you know, more professional care, and, you know, what are some remedies, you know, besides applying pressure, you know, like ice or things like that?
Right. So in general, we want to elevate the wound higher than the heart so that the bleeding is reduced and the swelling is reduced. You can put ice on the wound, of course, wrap it up with hopefully a clean cloth or gauze if you have it. You really wouldn't want to take any pain medicine right at that time, just the ice and the pressure, and getting yourself to a medical facility.
Okay, so now about bites, and there are many different types of bites, because, you know, we have so many different species of animal here on Guam. There are snake bites, bug bites, you know, spiders and everything. There is a pretty good poison control cadre of people here, and, you know, they can diagnose and treat things very quickly. But if someone gets bit, what do you recommend?
Well, again, it would depend on what bit them. If it was a stray dog, we don't have rabies on Guam, which is a blessing, so we don't have to worry about rabies, but you can still get infections from dog bites. Cat bites are much more severe, actually. Cats have much dirtier mouths.
Really?
Yes, they do. Dogs have, the surfaces of dog teeth are kind of straight and flat, whereas cat mouths, their teeth have a lot of crevices where a lot more bacteria can hang around. So cat bites are actually much more likely to be infected. Then, of course, if you have just insect bites, spider or you know, sand fleas or whatever, those usually don't need treatment, but you'd want to prevent infection. So don't scratch your bites. you know, put a little hydrocortisone on them, or just some ice, or wrap them up, or do anything you can so that you won't scratch your insect bites, because that's how they get infected.
And the most important thing, like if someone calls you up and say, hey, I got bit by something, try and identify exactly what bit you, because that makes it so much easier for you to treat.
It sure does.
Okay. All right, well, we'll come back after this commercial break, and we got some viewer questions, so we'll pose those to you. You ready?
Yes.
Okay, well, stay tuned. Dr. Lom and I will be back with more show after this.